Reproductive health care is a critical part of everyone's medical care, especially during young adulthood. Sexually transmitted infections, or STIs, like the human papillomavirus, also known as HPV, is so common that just about everyone will be infected at some point in their life, and 3/4 of those infections occur during young adulthood. Not treating an infection like HPV can lead to infertility, cancer, and even death. Young women primarily acquire HPV after contact with male partners. Although it may seem counterintuitive, sexual minority or lesbian and bisexual female adolescents are about as likely as their heterosexual peers to have had male partners. Even for young women who have sexual contact exclusively with other women, HPV transmissions require only skin-to-skin contact. Therefore, all sexually active women are at risk for infections, regardless of sexual orientation. While STI and Pap tests can screen for infections, these tools are underutilized and misunderstood, particularly by young adults and sexual minorities. The Institute of Medicine has specifically requested more data on Pap and STI tests among sexual minorities to help inform policy. Therefore, we examined nearly 5,000 young women in the Growing Up Today study, which is a national longitudinal cohort study of adolescents established in 1996. Compared to young women who identified as completely heterosexual, mostly heterosexual and bisexual participants were about half as likely to have had a Pap test within the last year, but 1.5 times as likely to have been diagnosed with an STI. These results were even more striking among lesbians, who were 90% less likely as completely heterosexuals to have ever had a Pap test. We published these findings in the Journal of Adolescent Health. Next, we wanted to understand what was driving these disparities. Previous research has proposed that sexual minorities are less likely than heterosexuals to visit a healthcare provider where they could get a Pap and STI test, since they use hormonal contraceptives less often. It's also been suggested that, in contrast to heterosexuals, sexual minority women perceive themselves to be at a lower risk for contracting HPV. This perception could be due to the focus of many sexual health campaigns on gay men's health and a subsequent lack of any messaging for lesbian and bisexual women. Compared to heterosexuals in the Growing Up Today study, sexual minority women held more negative beliefs about Pap tests, and fewer of them planned to get or actually got a Pap test in the next year, as was recommended at the time. Less hormonal contraceptive use in lesbians explained little of the disparities in Pap test intention, but it did explain nearly 40% of the disparities in actual Pap test use. Less of the disparity was explained by differences in beliefs. We published these findings in the American Journal of Public Health and noted that further research should explore other driving factors of the disparities so that evidence-based interventions can be developed. STI and Pap tests are needed by all women who meet current guidelines, regardless of sexual orientation. Healthcare providers and public health practitioners should be aware of screening and STI disparities by sexual orientation, in part attributed to less hormonal contraceptive use and less positive health beliefs among sexual minorities. Care should be taken to communicate the importance of these tests to sexual minority patients, which will not only improve reproductive health and overall wellness, but also reduce preventable outcomes like cancer and death in sexual minorities.